Hello everyone, Dr. Sam Schroetke here at Physical Therapy and Hand Clinic of Hillsboro with Technique Tuesday, our Christmas and Headache edition. I've done 3 videos where I was describing exercises for headaches, and I'm going to show an alternative now. None of those were working for me. So just as a quick recap, we did Sustained Cervical Retraction, which is this one. We did Sustained Cervical Flexion, which is this one. And we did Sustained Cervical Retraction with Flexion, which is this one. And I'm doing a little overpressure with my hands. If those weren't working, then you might give this a try. But you only give this one a try if your headache symptoms are one-sided. They're either asymmetrical or one-sided. So if you're having a headache that's just back here and it's equal on both sides, I wouldn't do this one. Or if you kind of had the headache on both sides equally, I guess. It's not common that both sides wrap around, but if that is happening and it's equal, I wouldn't do this one. So if the headache's only one-sided, or maybe you have a little bit on both sides, but it's definitely more prominent on one side, then maybe give this a try. So it has to be a one-sided headache, or it's not symmetrical. It's more on one side than the other. Then you might give this a try. So again, we talked about what brings headaches on. It tends to be sustained positions or certain movements, okay? So they also tend to respond to sustained positions. So this is going to be Sustained Cervical Retraction with Rotation, okay? Sustained, so you're just doing a light retraction with rotation, and you are always turning your head toward the painful side, not away, all right? So for this video, I'm going to say that I have a right-sided headache, all right? So what I'll do, sustain, I retract, and then I rotate, but I'm going to give a little overpressure. It tends to work better with overpressure. To do the overpressure, I'm turning right, so I'm going to take my left hand and put the fingers on my right ear, so it's toward the side I'm rotating. My other palm is going to kind of cup my jaw, so I retract, and then I rotate, and then with both hands equally, I'm just lightly pulling with both hands, and they're kind of going in opposite directions, but they're pulling my neck in the same direction. So here I go. Fingertips are to the ear. Other hand is cupping my jaw. I retract, rotate, and a little overpressure. And you hold this for 30 to 45 seconds as a test run. And if it felt okay, if it either felt better or you're not getting any negative effect from it, we're going to try it for 2 to 3 minutes. Okay, that's generally what the headache's like. This is another technique where you are going to want to have a supported back because you want to have a nice, good posture, especially because of the retraction. So I retract, I rotate, hand on the ear, other hand cupping the jaw, and I just lightly rotate. And you're trying to get to end range, that's important. Hold the retraction, and you're going to hold for 2 to 3 minutes. I'm not cranking my head. I'm not doing anything like that. I'm just giving a little overpressure to get to end range. I would probably do this 3 to 4 times a day and whenever you have a headache. Sometimes when you do the exercise, it totally abolishes your headache, goes away. Sometimes it feels better, so it's maybe went from being all the way around to just in the center or back here, or sometimes sometimes it intensifies a little bit, but then later on you will feel better. So if any of those are happening, I would keep going for it. You might have to try it for a couple of days to know if it's going to work. One more time, retraction, and I'm not doing the full retraction, just a little bit of retraction. We're rotating toward the side of pain, and I'm giving a little overpressure. And you're going to try to hold it for 2 to 3 minutes. This one's going to be tough because your shoulders are actually going to get tired by staying in this position. But 2 to 3 minutes, it tends to be the optimal time for this. One thing you do want to make sure is when you are doing that rotation with overpressure, that you're not pulling your head sideways or anything. You want to keep it straight, right? Just right in line with your shoulders, basically. So I'm rotating here, and then a little overpressure. That's probably the better way to do it. Retract, rotate, overpressure. 2 to 3 minutes, 3 to 4 times a day. All right. As with anything, check with your physical therapist or physician before doing these exercises to make sure that they are appropriate for you. I'm Dr. Sam Schroetke here at Physical Therapy Hand Clinic with our Headache and Christmas edition. Thank you.